Little update on the campaign and where we're at right now. As you may know, there are specific reforms that we are hoping to get passed. Four specific reforms. There's lowering the eligibility age from 65 to 60, adding vision, dental, and hearing, and instituting an out-of-pocket cap, and allowing Medicare to negotiate drug prices. And a couple of weeks ago, we kind of thought that we might get lucky if we could get the dental, vision, and hearing part in. And if we're really lucky, we get the drug price negotiation. Those things seem like they were, in reach. And there is now consensus, and it's very exciting for us that there is enough money in the top line budget resolution that they just passed, that these numbers explicitly include these Medicare improvements. So dental, vision, and hearing are definitely what Democrats have all committed to fighting for, at least. And I think that is a victory. I mean, it's not Medicare for all, but that is absolutely a victory. And it's, I think there's even consensus among, in DC that this is the work of the Medicare for all movement, that we have so successfully raised expectations for what a Democrat should be fighting for, that we're gonna maybe pull through one of the biggest expansions of Medicare in a long time, maybe since the expansion of disability benefits. Sorry about that. Yeah, so of course, we've got a long way to go, but this is still not nothing. And of course, the hardest to pass is lowering the eligibility age. It's the one that most cuts into insurer profits, obviously, especially if it's also done in conjunction with dental, vision, and hearing, right? Because that's one of the only reasons people really go into Medicare Advantage, choosing Medicare Advantage over Medicare, is because it bundles everything and then it gives you some dental and vision insurance. But if you combine these two, then you're sort of undercutting Medicare Advantage and you're expanding. And so insurers are really not interested in allowing us to start eating into their clients. And I think that also it's the one that I would love to see, of these reforms, I would love to see the most sort of grassroots enthusiasm through the form of letters to the editor. I think it would be great to see more coverage in the papers and more support for this particular reform. So what is a letter to the editor? So it's a short opinion piece, usually 150 to 200 words. So how many sentences do you think 150 words is? Anyone want to take a guess? Two. Close. It's actually not too far off. 10. Okay. Somewhere in the middle there. Yeah. So the question is, how many sentences is 150 words? And the piece that we're going to look at today, I don't actually know how many words it is, but I think that it was submitted to a paper with a 150 word count limit, and it is 4 sentences long. So I would say although 1 or 2 of his sentences were really kind of long. So I would say between 4 and 7 sentences is what you're going to be writing. So it's actually not a huge ask here. And whereas like an op-ed is going to be quite a bit longer, it's probably going to be more like 750 words, right? But we're just doing a letter to the editor today. So a letter to the editor has basically just one argument made. You can't do a lot in 150 words. And then, a letter to the editor is written often coming from the grassroots, right? It's coming from the readers in response to what the paper is putting out. So it's often written by community members, specifically in response to an article or news that's no older than, I would say, 2 days. And it's really great that we're doing this training right now because there's just so much coverage in the news about the spending bill. And I think a lot of it can be you can, even if it's not explicitly mentioning like the Medicare expansion piece, a lot of it can be sort of twisted to use that angle. Okay. All right, and so why are letters to the editor important? So if you've been reading the news and you're a Medicare for All supporter, you may have noticed that basically all of our media is never going to report on Medicare for All favorably or even fairly, I would say. And the narrative that they push around expansion, which is well short of Medicare for All, focuses, I would say, a lot on the cost, like how much it will cost to expand or lower the eligibility age, for example, for one thing, or to add vision, dental, hearing, whatever. It focuses really on the financial cost and not the human toll of inaction. And so I think it's really important that we respond to news pieces that cover the issue and are heard, even if, you know, not by the staff of the paper itself necessarily, but by those who read it, including, I think, our targets, our legislators, and their constituents. And they absolutely will be reading, you know, letters to the editor that are targeted to them, right? So if you include the names of your senators, well, they, you know, the media staff of these senators are constantly sort of scanning the news and doing searches for where they are mentioned, and this will pop up, and you will be seen by the office for sure if you write a letter to the editor. And then, of course, on top of that, they're also reaching an audience, the audience that you want to reach, exactly the audience you want to reach, right? The people in your state, the people who have the power to change what the senator does to vote them out of office, right? The constituents. And we're normalizing here the majority support for Medicare for All, right? So those two things I think are really important. And I'm seeing a comment article in the New York Times today by Sanger and Katz reported on medical debt as reported in JAMA, comparing states with and without Medicaid expansion. Would be a great article to respond to. It was also printed in our local Lancaster paper. Yeah, so that's a really good point that, you know, that I was saying before we started the webinar, that a lot of New York Times and some of the really big papers, they sort of like sell, right, their articles to more local papers. And so you'll be able to see some of the national coverage in the local paper. Okay. All right, so step one. You know, I thought that we would actually try to write our LTEs on this call as we're, you know, going through. And again, you know, they're only 4 to 7 sentences long. So even if you don't have like a fully polished product by the end of the call, you might still at least have like a clear outline of what you want to write. All right. So step one is choosing your paper. And you may already have one in mind, but if not, then you can simply do a Google search, right? Google top newspapers, and I put Georgia because that's my home state. And then you'll sort of get a sense of which are the newspapers in your state. You know, how do you decide on a paper? Well, larger papers are more likely to have, again, as we discussed, cover national news, which is where all the action is happening in Congress, and also more likely to mention senators, who are our targets for this LTE. And I'd say also that if you don't get into one, let's say you want to do the top newspaper in Georgia, that would be the AJC. Well, if you don't get into it, you can always try another. So I would say, you know, if you're targeting senators, then you probably want to go with a statewide paper. So I just thought, you have any questions or anything, put that in the chat. But I thought we would also, if everybody could put in the chat, which paper they would like to pitch to. Houston Chronicle, that's a good one. Chicago Sun-Times. Albany Times-Union, okay, great. Albuquerque Journal, Ohio Capital. LA Times. Washington Post, you can certainly try. And I think that, you know, local papers you're more likely to get in, and also you're more likely to reach the audience that you want to reach, which is the senator's constituents. But I think it's worth a try. San Jose Mercury, yep, that's a really big one in California, I know. Do papers print letters written by people that don't live in their area? For example, if I submit a letter to the San Francisco Chronicle and I live in Santa Cruz, that's a really great question. So, I mean, California is a little difficult because I think a lot of the papers are clustered in, you know, big cities. I mean, that goes for everywhere, of course. But because of that, because, you know, Santa Cruz may not be serviced by, you know, a large paper, I think it's definitely worth it to try to get into the San Francisco Chronicle for sure. And I think it's not that far of a reach, right? My California geography is not that great, but I think a lot of papers, like for example, the Atlanta Journal-Constitution, it's not really only serving Atlanta, it's serving the whole state of Georgia, so. All right, Maryland Progressive Healthcare Coalition regularly sends LTEs to the Washington Post and Baltimore Sun and have had articles accepted. That's great. Okay, great. All right. And if you have a local paper in Santa Cruz, you can try, but I don't think it's not, you know, not worth it to try a different one. So great. So now y'all have chosen your paper. All right, so then this is really important to know before you start drafting your letter to the editor, of course. So what is the word limit for the paper you're going to pitch to? So, you know, you can either find that by those guidelines by poking around the site. Usually it's under like a contact button, or submissions sometimes it's called. But you can also do, if you want to sort of like go directly to the page, you can do a separate Google search that should take you right there. So I Googled letter to the editor AJC, and I was taken right to sort of the submission guidelines. So next step is I'm going to give y'all a second to do that. And then if you want to put the word limit for your paper in the chat, we can do a little informal survey. $150. I feel like most of them are going to be around $150. And the other thing that you might want to take down, and you can just to note, is what are sort of what are the guidelines, right, for your particular paper. They're going to usually ask you for a certain level of contact info, and you know, they're going to tell you exactly what is the email address to send it to. So it's usually going to be letters at, and then the name of the paper.com. Okay. So there's some difference here. So there's $250 for the Denver Post. LA Times is $150. Baltimore Sun $150 to $200. Okay. Give everybody a chance to. Mercury has a web link to their opinion page with a 500-word limit. Yes. So that's op-eds, probably. And op-eds are a little bit different. A lot of the same principles. You want to have like a really punchy, focused thesis, and you want to say something a little bit, you know, maybe controversial, something interesting to read, something that's click-worthy. It's a little bit different than writing a letter to the editor. Maybe I'll do another workshop on op-eds. Albany Times Union, letter should be no more than 250 words. And the Albuquerque Journal, I think, is 300 words, but the opinion column is 550. Yeah. Okay. All right. Great, y'all. Okay. So now we know the paper, we know how many words we have. Now we're gonna look at quickly the elements of a letter to the editor, and then we'll take a crack at writing our own. Okay, so there's 4 parts of an effective letter to the editor. Again, it's only 4 to 7 sentences, so each of these parts is.
Let's see, we went.
Oh,
we
if
just
y'all could put yourselves on mute if you're not. Thank you. Right. So each of these parts is going to be 1 to 2 sentences long, max. So I mean, if your op-ed, or sorry, if your letter to the editor is 150 words, then it's probably going to be more like 1 sentence or 2 short sentences each. And then if it's more on like the 300 side, then you might get a full 2 sentences for each part. So, you know, the second part is, oh, I'm sorry. So part 1 is referencing the article. So what papers like to see is that you're responding to what they've written, and creating a dialogue with the paper and the readership, right? One of my favorite parts actually of The Economist magazine, which comes out weekly, is the letters to the editor. They have it right in the front, and it's just always interesting to see, like, you know, these articles that I read last week, like, and my reactions to them, and seeing if there's like anybody else who had that same reaction. Yeah, so one is that you know, you don't just want to like start with your opinion, you want to sort of like reference an article that they have, they've put up, to start that dialogue. And then the second thing is you want just a short and clear thesis. So, and I don't think that anybody in this room is in danger of this, but instead of saying something like, you know, we should really do something about drug prices, like we need to allow Medicare to negotiate drug prices. And then number 3 is your personal story. So super important, I think, that, you know, you tell your personal story instead of sort of citing statistics or policy or data. And the reason I think is just that policy and data is something that legislators and even the public is kind of thrown at all the time. And your personal story is something that it's very difficult to, well, first of all, it's difficult to argue with. And second, it's something that actually like sticks in your brain more. I mean, the reasons, when I think about like the reasons that, you know, I'm a Medicare for All supporter, it's because of my own personal experience with the healthcare system. And also not just my own, but hearing other people's personal stories and thinking, wow, we're like in this shared experience together. And, you know, we should probably do something about it, right? And then part 4 is the ask. So, you know, that is, we're going to name names here. We're going to put the full name of our senators in there, and we're going to ask them for what we want. So next, we're going to read an actual LTE that was just published a couple days ago in the San Francisco Chronicle by our activist Michael Leidy. And it's just sort of a textbook example of how to do an LTE. So we're just going to kind of dissect it quickly. And I'm going to talk about why I think he was successful in getting it published, and why I think it's impactful, and then jump into writing our own. Okay. Any questions or anything so far? Okay. Hi, Sharon. Great to have you. We're just getting into the meat now, so hopefully you didn't miss too much. Okay, so the first one is, the first part of his letter to the editor is regarding this article, Biden meets with Dems to firm up spending support, July 15th. He's referencing the article, so they know immediately when they open up the email and their letter to, they probably get a million letters to the editor, right? And when they open it up, they see, okay, this person is actually reading the paper and they're responding. So, you know, he goes on, while I read recent reporting on the Democrats' plan to improve Medicare benefits, which is a good step. Then second element of an effective LTE is a short, clear thesis. The plan must include lowering the Medicare eligibility age to 60 and instituting a cap on out-of-pocket expenses. Okay, that's his thing. That's what he's saying in this article. Okay, next he gives his personal story, and I'll let you read it, but it's only 2 sentences long, actually. But what sort of, actually, I'll just let you read it for a second. So what struck me about this was how much detail he managed to pack into 2 sentences. I mean, how much of his personal story we actually know after 2 sentences, right? For 60-year-olds like me, we know his age, we know what he's dealing with. He has chronic health conditions and he names them. Not everybody's comfortable with doing that. You don't have to do that, but you know, we're really, you know, having a picture painted for us here. And he talks about, you know, his insurance as being expensive. How expensive? He names it $2,100 a month. And then, you know, a really a sentence about, you know, that you can really like sort of a gut punch, right? The health security and the peace of mind that Medicare provides is life-saving. And then here he goes straight, you know, to the ask. I urgently need Medicare, and I urge California Senators Dianne Feinstein and Alex Padilla to support this improvement and expansion of Medicare funded by the savings from limiting prescription drug prices. So any questions or comments on this? And yes, I can share the slides. Okay, so who is ready to start writing their own letter to the editor? Okay, great. Yes. And the question about referring to a bill number or an act being discussed. So in this particular situation, because it's just such a weird, and I'm still wrapping my brain around how the whole reconciliation process works, but you know, there's probably a bill number. I don't know what it is, but nobody's talking about the bill number that it is, right? It's just the spending bill, it's the reconciliation package, you know? And so it's okay to just reference that, I think. In terms of, you know, when you're talking generally about Medicare for All, I don't think it's necessary to actually put the bill number. I think Medicare for All Act is good enough for the newspaper. Okay, next. Time is it? Okay, 30 minutes. Great. So, so why don't y'all open up a blank Google Doc or Word doc or whatever it is you use to compose. We're going to go a little out of order. You know, because step 1, finding your reference, you know, is probably going to take quite a long time to go through the paper and figure out exactly which one you want to respond to, but you might already know what you're going to say. So I think we'll focus on our personal story and the stuff around it. And somebody is asking, what if you don't have a compelling personal story you are comfortable sharing? We'll get to that. Okay. All right, so again, because of, you know, the logistical problem with finding a reference piece right now, I think we're going to start with part 2, which is you're taking, you know, you're starting with your thesis, your strong stand. Oh, you know what? I was actually going to do like a little poll. Let me see if I can. Oh God, I'm so bad with Zoom. Yeah. Well, so, you know, I was going to do a poll, you know, asking whether you're in the age range of 65 and plus. Are you like in the Medicare age range? Or if you're in the like 50 to 65 range, or if you're sort of, you know, under that age, like 49 and younger. Because I think that's going to matter in this particular for this particular action. So if you're doing like just a general like Medicare for All letter to the editor, then it's not going to matter as much where you are age-wise. But because Medicare expansion is going to really affect people, going to really affect some people and then really not affect other people. It's one of those things where you want to take, you know, especially coming from a personal story perspective, you want to use or you want to choose a topic that you think will actually sort of affect you. So if you're in the 50 to 65 range, I would say like lowering the eligibility is a really great hook for you. You're the ones most impacted by this reform and you're gonna vote accordingly, and you should let your senators know. And then if you're, you know, 65 plus, then both the out-of-pocket and the drug negotiation pieces make a lot of sense, right? And I would say if you're really nowhere near Medicare age, then you have a couple choices. The strongest, I would say, is to tell a personal story about yourself, or it could be about, a family member or a friend, or how they might be impacted. When I'm going to write my story, I'm 36, so I'm really far away from Medicare right now. But I'm going to be talking about my mom, who's 59, and is working a job at REI, making $15 an hour, just for health insurance. And a lot of, maybe most of her income is actually just going to her premium. So back to the company, right? Back to REI. And the hardest thing about this is that my dad has some early onset dementia. So she has to leave him to go to work every day and worry that he's gonna get in the car and forget where he's going, and all that kind of stuff. So I think I would be telling a story about a family member or a friend, because I'm too young to be impacted by Medicare. So if you don't have, if you're my age and you don't have a story that you feel comfortable telling, or you want to tell, then you can, weave in a local statistic. So for me, I would probably say how many Georgians would be affected by this. And that's kind of a whole research project, but I think it's actually pretty easy since there's just so much comprehensive, health data done by Kaiser and all that, that is pretty easy to find if you need that. But I would try to weave in sort of the local, perspective on that. And I think that there are a lot of people who would be affected by lowering the eligibility age in every single state, whether it's Georgia or New York. So that's probably a safe bet. I'm just going to catch up on the chat here. Do we have any good references that cite the number of people over 40 or 50 who become unemployed or having a hard time landing a job, presumably because of impact on employer insurance costs? Yeah, as I was saying, I think that there's actually a lot of, Kaiser has done this data, and I can link to it as well after the webinar. Yeah. Okay, so does somebody want to share, which of these three reforms they think they would like to use to focus on their LTE? Ooh, Edward has already written one. Edward, I'm going to ask you to share it once again in the chat, a little bit later when we're sharing. But I'm really excited that you have written one, and I would like to read it. Okay, so there are a lot of good personal stories here. It just started thunderstorming here. Yeah, so the three reforms that we're pushing, or rather there's 4 reforms that we're pushing, but we're pretty sure to be guaranteed of one of them, and that is expanding Medicare to include dental, vision, and hearing. And then the other 3 that we feel like we need an extra push for, someone's asking if I could repeat what the reforms are. So the 3 reforms that we're really fighting for are lowering the eligibility age, and instituting an out-of-pocket cap on Medicare, which is, actually insurers are required to have an out-of-pocket cap, but Medicare is not, which is so crazy. And allowing Medicare to negotiate the price of drugs. Yeah, so I see a lot of people are interested in lowering the age and also negotiating drugs. And I think that those are all important. Out-of-pocket cap is also really important, I would say. It's one of the things that can really, if you get a nasty, expensive treatment or disease, then you can you can lose a lot. Kids first. Kids would be a really interesting reform. I don't know if it's on the table right now, but okay, great. So I'm so excited to read all of your op-eds or letters to the editor. All right, so the next part we want to do now that we've chosen is we want to start actually writing our personal story. So you want to write, you know, a couple sentences on how this reform would impact you or a loved one's life. And again, you know, for me, when we also do a tell your story training. And so, and we do like different versions of our story. So we get it distilled down for like a 2-minute to a 2-minute version. And, you know, usually it starts out when you start telling your personal story. And when I started doing it, it was like 5-minute long story. And I had to like strip it down to 2 minutes. And this is even harder because you're going to have to strip it down to like 3 sentences, 2 or 3 sentences, right? But what I always tell people when they're going through the tell your story training is that you want to, you know, don't worry about the length. Just write what you think your story is. And then after that, you can, you know, sort of say, okay, this is the important thing, or this is how I can condense this. So, you know, first, don't like turn the editor on, just write, and then figure out how you're going to condense it after that. So I'm going to give everyone like, I don't know, how about 5 minutes to just think about your personal story and get sort of a draft of that. And the other thing I wanted to say about a personal story is that, you know, I have a lot of personal stories. You know, when you really start to think about like why you're in this movement, there's definitely something going on there, right? And sometimes it can even be something positive. Like for me, sometimes when I tell my personal story, I focus on the fact that I, you know, married a Danish guy, and then I got to live in Copenhagen for 3 years, and now we're living in Boston. But you know, when we were living there, I got to experience a real single payer. It's actually, Denmark has socialized medicine, sort of like firsthand. And so sometimes, you know, your personal story can be a positive thing. It was like, oh, I experienced, you know, a real single payer. A lot of people who go abroad have that story about why they're fighting for Medicare for all, is because they experienced guaranteed comprehensive healthcare in Japan and South Korea and Europe. So. All right. So I see a lot of people concentrating, which is great. It means you're deep in the work here. And I was gonna ask people to start putting, their little snippet in the chat, and already people have been doing it, and they've already been so good. Bob says, I'm on Medicare. I would write about people who are 60 to 65 who have a chronic condition and the cost of it is barely manageable through their current insurance plan. So they have to continue working while they fear for their life. May says, as a self-employed freelance worker in my late 50s who had cancer and who depends on her union-sponsored healthcare, I live in constant fear of losing that coverage because I may not have enough gigs to qualify 1 year. I think that a lot of people are gonna resonate with that. Sydney says, I'm spinal cord injury, 47 years. Was very fortunate to have first class rehab in 1974 that allowed me to be completely independent the day I left the hospital. That kind of post-trauma injury simply doesn't exist any longer because of insurance restrictions, both private and Medicaid. That's actually really true. We did this study about how the time that you spend in the hospital is just less and less and less since the 70s. And I think that's probably to patients' detriment. Okay, great. And so y'all can keep working on that, or, go ahead and please throw them in the chat if you can. Okay. So the next part is the ask. So here again, we're going to name names, specifically our senators, and ask them to support the reform. And again, we do that so that when the office searches, they will see that these names come up and that there's been a letter to the editor speaking to them, and that we are actually aware that these reforms are being considered in Congress and that we're watching what they're doing, right? So if you want to take, another couple minutes just to write your ask and sort of bolster it with what it would mean for people or how it would impact you, that's a good way to end your letter to the editor. Okay, great. And I'm seeing some submissions in the chat here. That's great. Suggestion: avoid negatives if you think it helps make your point, because people remember negatives. So avoid things like the major objection to Medicare is, instead go with the positives. Yes, that's really true. You want to focus on your argument, not your opponent's argument, because that in a weird way legitimizes their perspective. And Ed, I did also see that that article that Sarah Cliff reported on, and that is wild that the ACA has, after I mean, exactly coinciding with the implementation of the ACA, we're seeing medical debt sort of explode there. Okay, awesome. All right, and then going back to part one, and then we're going to finish by talking about how to submit your piece. So when you go to actually put in the piece that, you know, that you're going to respond to, that's just sort of like a segue into the thing you want to talk about, which is expanding Medicare. I would do a search on the website. You can search things like Medicare, spending bill. That's, I think, how I found a lot. Reconciliation, that's also gonna bring up hits. And then if you can't find anything like that, there's probably some local coverage on Medicaid that you can make a stretch segue to. Right, that was my next point, in that if there's no obvious tie-in, you can get creative with the Medicaid expansion, or, you know, a local context or statistic. So if you're like totally out of, there's nothing that really hits, you know, anything that's going on in Congress right now with the spending bill, the infrastructure package, then you can just start by talking about, you know, healthcare and in the state, and, you know, how many people are needing healthcare, and, you know, whatever. So, and I was hoping we'd have time to do a quick search here, but I don't think we do. So we're going to jump into submitting your piece. Just catching up on the chat here. Yeah. Great points all. Okay. So finally, you know, when you submit, there's just a couple things you want to do. You want to just go back to the letter to the editor guidelines that we just found at the beginning for email. So it's usually just going to be like an email that you send. I would say do not use a Word doc, like don't put it in a Word doc and then use an attachment, because a lot of, I mean, and this goes especially for legislators' offices, because they don't want to open stuff with viruses, but also to newspapers, it's just better to actually put it in the body of the email, so it doesn't get, you know, sometimes things with attachments can either get caught by a spam filter, or the, you know, the recipient is a little wary of opening it from someone they don't know. And then there's, you know, just like a short intro. You really don't have to say a lot here, because for a letter to the editor, you don't have to say a lot. If you're doing an op-ed, then you probably want to do like a whole, like a short summary and teaser. But because the letter to the editor is so short, it's all going to be like right there in the body. So, and then just, yeah, whatever is the required contact info. And I see here that, let's see, people are putting in their last bit, the asks. May writes, Medicare for all, or for more people than before, is going to save money for all. California is supposed to lead. That's true. I urge our senators Feinstein and Padilla to lead us to real progress. Great ending. And please help all Americans by insisting that the age of eligibility to 60 be included in the expanded Medicare package. I like it. And what do I mean by using the website for the search? Right, which website? Great question. So when you figure out your paper, you go to the paper's website, and then there's usually a search right at the top. So ajc.com, and then there should be like a search function. And that's to find the article that you're going to want to respond to. Any other questions or comments? If we have like a couple more minutes, then people can actually go and see if they can find something that they can use on for their reference piece that they're replying to. I'm glad that y'all found it helpful. And yes, I think that this is, absolutely, you can use this format, not just for Medicare expansion, but, we're going to be doing more for Medicare's anniversary, which is coming up at the end of July. So there's going to be opportunities to write more letters to the editor for Medicare's anniversary. Really, like, Bernie Sanders' bill is probably going to be dropped later in fall when the reconciliation is all done and we can actually focus on that bill. So there's so many opportunities to get published in your papers. So yeah. All right, well, thank you all so much. And when you're, I forgot to write the most important thing, which is when you get published, and don't give up on the first one. If you don't get it into the first, then just send it to another one, or maybe there's going to be a more relevant piece of news that comes up in the next couple of days, and then you'll be able to respond to that. Then, you can go ahead and email me at Stephanie@healthcare. Oh, whoops, I only sent it to one person. Stephanie@healthcare. Email me with a link and I will absolutely amplify it on Twitter through our email list and hopefully start a collection and also circulate it among all the other Medicare for All groups so they can also amplify it.